Michele Carpenter, the Medical Director of the Breast Program at the Center for Cancer Detection and Treatment of St. Joseph's Hospital. Most women find their breast cancer themselves or their partner finds it just in examining the breast. The biggest thing about breast cancer is that it can happen to anyone. The prime age groups that it usually occurs in is ages 50 to 75. We do screening mammograms after the age of 40 or in high-risk women earlier. And when we find it on a mammogram before it's palpable, we actually know that we improve the prognosis. We treat patients with breast cancer in a number of different ways. If it's a nice small tumor, we can start with surgery, and not everybody needs chemotherapy. What happens in a small tumor is we have the option of doing a lumpectomy. It's also called a partial mastectomy. And we add radiation to that to make that procedure as good as removing the whole breast, which is a mastectomy. Sometimes the tumor is too big or there are too many tumors, and if that's the case, we need to do a mastectomy, and we can start the reconstruction process a lot of the time at the very first operation. Reconstruction is then a process, and it usually requires a few more procedures, but it's really nice when we can start it at the beginning. Not everybody needs chemotherapy. We do have patients who have a little more advanced disease. We've checked their lymph nodes at the time of surgery or sometimes before surgery with a needle biopsy, and those patients will require chemotherapy. We also do special tests on the tumors. Some of those tests include the sensitivity of the tumor to hormones, and in the event of a hormone-sensitive tumor, we have other agents that are pills that patients take on a daily basis, and they usually take them for about 5 years. The steps after diagnosis of breast cancer really varies depending on what kind of cancer you have. Most of the time today, we feel that an MRI is in order on newly diagnosed breast cancers. Once we have the MRI and we confirm that there's just one tumor, then usually the next step is surgery. Whatever operation you and your doctor have decided is the next place we start. Once we're done with surgery, if the tumor seems to be one that we need to treat with chemotherapy, then once you're healed, we start the chemotherapy process. That usually happens about a month after surgery. If you've had a mastectomy, most of the time you're not going to need radiation after chemotherapy.